Well, good afternoon again, and it's a challenge to follow Frank, who's so poetic about things and so visionary. And it's been a pleasure to be here with you this afternoon. And I'll just comment in a few ways that again, if we had all day, we'd still be puzzled about how to do things better, how to balance all the paradoxes we have in front of us. Both groups that I saw brought up great questions about balancing one thing after the other that are posing pressures and realities for everyone. So again, I would echo that you're asking the right questions. I think it's important to understand that you are in actually a healthy and functioning place. None of us are going to be comfortable in our career going forward. Primary care was sort of lagging in this degree of change. It was always hard work, but it's been lagging for at least a decade or more to the degree of change that other factors, other aspects of healthcare delivery services and education were going through. Hospitals are transformed and are continuing to do so, but that started 20 years ago. Lots of engineering has been the same way. In primary care, until about 5 or maybe 8 years ago to me, our interactions in the care systems were pretty much the same they'd been in 30 years. A few differences, but not fundamentally different. Now that we moved into teams, population-based health, accountability for everything from education to practice and research, we're new at this part of it. And I think that we're not going to be comfortable. And I think we have to get used to that. If it were a term new normal, we aren't going to be comfortable in this era. And I think that's okay, because we're uncomfortable, because we're moving toward better ability to meet the patient's actual whole person needs, as some people might call it. It's a lot about what we do well in our clinical interactions, but as Frank and others of you have mentioned today, it's also about how to engage that wider community. Those are resources that aren't professional in a sense, but they're where healing has always been. Families and communities have always helped people recover, stay well, and we sort of lost our focus on that. Excuse me, as the magic of technology has taken us since World War II into where we are, we've lost some of the wisdom that came from grandmas and grandpas and communities and leaders in those communities. We'll learn. We will have to learn how to re-engage that group. I've used the metaphor previously, not necessarily here, that we're at risk in our healthcare system, especially primary care, of building fixed assets in a mobile world, in an electronic world. It's equivalent to the Maginot Line in World War II, where the big 114-kilometer mile or long fixed embattlements were built by France, and the opposing army just flew around them and drove around them in tanks. They didn't need to run right into the wall that was built there, but it was built in a different era with different thinking. Well, our primary care clinics are at risk of being the new Maginot Line. The world out there is where health is. So we can reach it, we can do it, we have a lot to offer, but it isn't all about us. It's engaging the wisdom of those people out there that aren't always feeling invited. So what I heard today was you struggling, and we all are struggling, I certainly am, with how to engage that wider participating group of citizens to help us do better, whether it's mental health, my favorite topic, or anything else. It's not about the next layer of newer, fancier medications with untold side effects. It's about being active, being engaged in life, taking a hold of someone's well-being for themselves. I love it when it's, whether it's a therapy session or in clinic, when a patient kind of perks up and says, wait a minute, you mean I'm in charge of my health? Yeah, that's right. Holy smokes, I better get busy. That's it. Bingo. I'll quit. You don't need me now. I'll just tag along. So when that moment happens on an individual level, really good things can be possible. So I think you're in the cusp of that discovery that let's just pretend for a minute that you're in charge. You all are in charge of this department. You're actually going to determine what happens. It's not some external force. It's you. You have all the wisdom that's needed. It's all we've got, by the way. It has to be good enough. It's what we have. And the adaptive world out there has learned to make do, as Frank and others have said, with enough resources. That happens to be what we've got. So let's use it. I think it's not impossible to get more resources of all kinds, but mostly we have the resources we need. We have the capacity to create the environment and the work circumstances and education and research that we need within reasonable limits. You can determine that. And when people come to my office, I actually I've said this in other platforms, the best job in the world. As a department head, as a clinician, as an educator, all of you, the best job in the world is, whether it's my staff person out front, administrative assistant, a resident, a fellow, a nurse, another faculty member. My job is to help the person before me grow and develop to the best of their ability. That's actually also our job in being well for others. You have that job now. And I think you can do it, but it's not easy. It's tiring, and often frustrating, often unrecognized. But the little joy that you can have when a learner or a patient or anybody in the cycle perks up and says, "You mean I'm in charge?" "Yeah, you are. I'll help, but I can't do it for you." "Oh, well then I better get busy." That's what I think you are able to do. So you're in charge. You have the resource to do the next best thing. And I think you won't build a marginal line. You'll build a creative, outward-reaching enterprise, both for education and research and for practice. All three that I know you can do. And you've got good leadership, you've got a good institution, you've got a pretty good state. And we neighbors will help each other along the way. So thank you for inviting me. And I would be eager also, as well as Frank, to learn, probably through reading, what you do next and next and next, because it's a never-ending journey. So thank you.